everyone. Today, myself, Audi, and Anagha will be discussing female reproductive health, in particular, contraceptives. On this slide is who we'll be presenting today. As future pharmacists, we chose to talk about contraceptives to understand the different over-the-counter and prescription options there are for pregnancy prevention. We want to help the general public, especially those who are sexually active, be more well-informed, make safer choices, and have healthier outcomes when it comes to contraception and pregnancy. Today, we'll be discussing 5 contraceptive options: intrauterine contraception, which includes copper IUDs and Levogestrol IUDs, hormonal methods, including implants, injections, oral contraception, patches, and the hormonal vaginal contraceptive ring, barrier methods, including diaphragm, sponge, female condom, male condom, and spermicides, emergency contraception, such as emergency contraception pills, and lastly, permanent contraception, including female and male sterilization. First, I will be talking about intrauterine contraception, which is a commonly used long-acting reversible contraceptive. There are 2 types of intrauterine devices, abbreviated IUD, copper T IUD and Levogestrol IUD. Copper T IUDs are small T-shaped devices placed inside the uterus by a doctor to prevent pregnancy. It can last inside the uterus for up to 10 years. The device can be taken out at any time by a trained professional, and the chance of becoming pregnant will go back to normal as soon as it is removed. It works by releasing copper into the womb, which alters the cervical mucus. This makes it difficult for the sperm to survive and reach the egg, thereby preventing pregnancy. It has a typical use failure rate of 0.8%. All the failure rates in this presentation are typical use failure rates, meaning that it expresses the effectiveness of all individuals who use the method, including those who use it inconsistently or incorrectly. The Levogestrol IUD is a small T-shaped device like the copper IUD. It can last inside the uterus for 3 to 6 years, so a little less than the copper IUD. It is also known as the hormonal IUD because it releases a small amount of progestin. This thickens the cervical mucus, creating a hostile environment for sperm to survive and reach the egg, thereby preventing pregnancy. Just like the copper IUD, it can be removed at any time by a trained professional, and normal fertility returns once it is removed. It has a typical use failure rate of 0.1 to 0.4%.
Now let's discuss the different hormonal methods for contraception. I will be giving a brief overview of the following 5 types of commonly used hormonal contraceptives: implants, injections, oral contraceptives, the patch, and the hormonal vaginal contraceptive ring. The first hormonal method we'll take a look at is the implant. As shown in the image to the right, an implant is a thin rod inserted under the skin or subdermally in the upper arm area. It contains progestin, and the lack of estrogen makes it good for use in women with elevated blood pressure or history of thromboembolic disease. Progestin is released over a span of 3 years, therefore making it a sustained release method. Some of the common side effects in the initial use are menstrual irregularity, headaches, and weight gain. In order to use this method, it requires a doctor's visit for the implantation procedure, and the typical use failure rate is 0.1% as per the CDC. The next method is a hormonal injection. The injection contains progestin hormone and requires regular visits to a healthcare professional every 3 months. It can be administered intramuscularly in the upper outer quadrant of the gluteus maximus or in the upper arm. A common side effect is the absence of menstrual cycles, and the typical use failure rate is about 4% as per the CDC. There are 2 types of oral contraceptives: the combined oral contraceptive, which is often termed as the pill, and the progestin-only pill, which is often termed as the mini pill. Combined oral contraceptives contain both estrogen and progestin. They're not recommended for patients who are over 35 years old, have a history of smoking, blood clots, or breast cancer, because the estrogen in the pill can increase the risk of these conditions. The mechanism by which this works is suppression of ovulation by inhibition of gonadotropin-releasing hormone from the hypothalamus, as well as the inhibition of luteinizing hormone and follicle-stimulating hormone. The common side effects include nausea and bloating. These should resolve within 3 months of use. The cyclic packs contain either 21 or 28 tablets, and the typical use failure rate is about 7% as per the CDC. The progestin-only pill has fewer side effects compared to the combined oral contraceptive pill. The mechanism by which this works is thickening the cervical mucus and thinning the endometrium lining so that the sperm cannot reach the egg. These come in packs of 28 pills, and they're a good option for women who cannot take estrogen. The typical use failure rate is about 7% as per the CDC. For both types of oral contraceptives, a prescription from a doctor is needed. Taking oral contraceptives relies heavily on patient responsibility since the medication must be taken at the same time every day. If one pill is missed, take it as soon as you remember. If 2 or more pills are missed, take the medication at the usual time and then remember to use backup contraception. The next hormonal method is the patch. The patch contains both estrogen and progestin. It can be placed in the lower abdomen, gluteal muscle, or upper body area. It is prescribed by a healthcare professional. The method of use is replacing the patch every week for a total of 3 weeks, and then avoid wearing the patch during the 4th week to allow for the menstrual period. Since the estrogen levels are higher in the patch compared to oral contraceptives, there is an increased risk of blood clots in the legs or the lungs. So those who are susceptible to blood clots should consult with their doctors regarding the risks of using this method. The typical use failure rate is about 7% as per the CDC. The last hormonal method that we'll be discussing is the hormonal vaginal contraceptive ring. It releases both progestin and estrogen. It is placed inside the vagina, and it is prescribed by a healthcare professional, although it does not require the assistance of a healthcare professional to insert it. The method of use is wearing it for 3 weeks and then taking it out for 1 week to allow for the menstrual period. For each subsequent cycle, use a new ring. Some of the side effects are breakthrough bleeding or spotting, and this may occur more often than oral contraceptive methods. The typical use failure rate is about 7% as per the CDC.
So now I'll be talking about barrier methods to birth control. These methods act to block the sperm from reaching the egg. Some methods, like the sponge, condom, and spermicide, can be bought in most drugstores without a prescription. Others, however, like the diaphragm or cervical cap, have to be prescribed by a healthcare professional. First, we'll start off with the diaphragm or cervical cap. The top image shows a diaphragm and the bottom image shows a cervical cap. Diaphragms can be rubber or silicone, while cervical caps can be plastic or rubber. Both are dome shaped with firm, flexible rims. These devices work to fit inside a woman's vagina and cover the opening of the uterus, which is called the cervix. They should always be used with spermicide, which I'll go more into detail about in the next few slides. They are inserted no more than 6 hours before sexual intercourse and must remain in place for 6 hours after. It's important to note that you'll have to visit your doctor for a proper fitting, since they do come in multiple sizes, and both will require a prescription from them as well. The typical failure rate of preventing a pregnancy for the diaphragm and cervical cap is 17% according to the CDC. Next, we have the sponge, which is a soft, thick foam disc containing spermicide. The sponge has to first be wet, and then it's inserted into the vagina to cover the cervix, keeping sperm from entering the uterus. The spermicide will also inactivate the sperm. The sponge can be put in up to 24 hours before sex and should be left in place for at least 6 hours after sex. These can be bought without a prescription. The sponge is less effective in women who have given birth, which is indicated by the failure rates listed: 27% for women who have had a baby, but 14% for women who have never had a baby. It is recommended that women who want to use the sponge after having a baby should wait at least 6 weeks after giving birth until the uterus and cervix return to their normal size. Now we'll be talking about the female condom, which is a thin plastic pouch that lines the walls of the vagina. It is held in place by a closed inner ring at the cervix and an outer ring at the opening of the vagina. The idea is to prevent sperm from getting into the vagina, and it can also provide some protection against sexually transmitted diseases, STDs, and sexually transmitted infections, STIs. The female condom can be inserted up to 8 hours before sex and should be thrown away after sex. The failure rate is 21%. The male condom is a thin sheath that's made of either latex, which is rubber, polyurethane, which is plastic, or natural animal membrane like lambskin. It's worn over the erect penis during sex and keeps the sperm from getting into the vagina. The latex and polyurethane types can also help to prevent STDs and STIs. Like the female condom, the male condom should be thrown away after sex. The failure rate is 13%. Both the male and female condoms should be used with a lubricant to prevent them from tearing or breaking and to reduce irritation. But oil-based lubricants should be avoided with latex condoms because it can weaken the condom. Adding on a spermicide can further help pregnancy prevention. You can buy both types of condoms without a prescription, but it should be noted that a male and female condom should not be used together. And finally, we have spermicide, which is a chemical substance that inactivates sperm. Most spermicides in the US contain a chemical called nonoxynol 9. It comes in different forms, including foams, creams, gels, suppositories, and films. Spermicide can be used alone or with other barrier methods. When used alone, it should be inserted into the vagina close to the cervix. Generally, it is placed no more than 1 hour before sex, but read the label carefully to be sure, as this may differ from product to product. Keep in mind that spermicides are effective for only 1 hour after they're inserted and should be left in place for at least 6 to 8 hours after sex. You must reinsert spermicide for each act of sex. You don't need a prescription to buy spermicide, and the failure rate is 21%.
The fourth category of contraception I'll be discussing today is emergency contraception. It is important to note that emergency contraception is not a regular method of birth control. It's only used after no birth control was used during sex or if a birth control method failed, like a condom broke. Emergency contraceptive pills can be taken up to 5 days after intercourse to prevent pregnancy. However, the sooner you take the pills, the better they will work. Emergency contraceptive pills prevent or delay ovulation. They do not induce abortion. It will also not work if pregnancy has already occurred. As I mentioned before, they can be used when no contraception was used during sex, when a contraceptive has failed, or when sexual assault has occurred. There are different options available such as Plan B one-step, My Way, and Option 2. It is important to not rely on emergency contraception as long-term birth control because there are many side effects from frequent use and they're not as effective as standard birth control methods. Lastly, I will talk about permanent contraception, including female sterilization known as tubal ligation or tying tubes, and male sterilization known as a vasectomy. Tubal ligation, commonly referred to as tubes tied, is a permanent birth control method where a woman has her fallopian tubes closed so sperm and egg are unable to meet for fertilization. The procedure is done in a hospital or surgical clinic. It can be done at any time, including after childbirth or in combination with another abdominal surgery like a C-section. After surgery, one is able to go home the same day and resume normal activities within a few days. After the procedure, a woman will still have periods and can have sex normally. It has a typical use failure rate of 0.5%. Vasectomy is a permanent birth control method where the vas deferens is cut and sealed. This prevents a man's sperm from going to his penis so the ejaculate does not contain sperm to fertilize an egg. The procedure is done in an outpatient surgical clinic. Just like with tubal ligation, the man can go home on the same day after the surgery. Once the operation is complete, after 12 weeks, doctor will test the sperm count to make sure it has dropped to 0. Another form of birth control should be used for those 12 weeks until the sperm count has dropped to 0. Vasectomies have a typical use failure rate of 0.15%. Thank you for listening to our presentation.